Welcome to our video on diarrhea and malabsorption. Let's begin. In this lecture, we will discuss carcinoid syndrome and irritable bowel syndrome. Here is the sequence of topics that will follow when describing this disease. Carcinoid syndrome is a constellation of systemic signs and symptoms caused by a carcinoid tumor. A carcinoid tumor is a neuroendocrine tumor most commonly found in the small intestine. Let's talk about the pathophysiology of carcinoid syndrome. A carcinoid tumor, which normally produces serotonin, does not cause systemic signs and symptoms if it stays localized to the GI tract. This is because serotonin in the portal vein is broken down by liver via fast-pass metabolism. However, if the carcinoid tumor metastasizes to the liver, then serotonin is no longer broken down via first-pass metabolism, and it is released into systemic circulation. This will induce the systemic signs and symptoms that we will discuss in the next slide. Carcinoid syndrome causes bronchospasm and wheezing because excess serotonin induces bronchoconstriction. Episodic flushing occurs due to serotonin-mediated cutaneous vasodilation. Diarrhea is caused by serotonin-induced GI overactivation. Additionally, patients with carcinoid syndrome may develop right-sided valvular lesions, specifically tricuspid regurgitation and pulmonic stenosis. This happens due to serotonin-mediated fibrosis of the valves. It's worth noting that left-sided valves are spared due to lung-mediated serotonin breakdown. Additionally, patients with carcinoid syndrome can develop niacin deficiency and pellagra. This is because tryptophan is the common precursor for serotonin and niacin. Carcinoid syndrome causes shunting of tryptophan to serotonin production. Therefore, there is insufficient tryptophan for niacin production. Pellagra is characterized by 3 Ds, which include diarrhea, dementia, and dermatitis. Dermatitis in pellagra is characterized by hyperpigmentation in sun-exposed areas like limb and neck. Castle necklace, which is a circumferential rash in C3, C4 dermatome, is also characteristic of pellagra. Here you see how serotonin, also known as 5-hydroxytryptamine, and niacin are connected to each other via tryptophan. Shunting of tryptophan to the serotonin pathway increases serotonin and depletes tryptophan for niacin production. Therefore, the patients with carcinoid syndrome develop niacin deficiency, causing pellagra. Here one can see the rash in pellagra. You can appreciate these hyperpigmented areas on the hands and neck. Diagnosis of carcinoid syndrome is made by measuring urinary levels of 5-hydroxyindole acetic acid, which is a serotonin metabolite. CT scan of the abdomen can localize the primary carcinoid tumor. We can also perform a biopsy of the carcinoid tumor. Histological exam of the specimen will reveal rosettes and a positive stain for chromogranin and synaptophysin. Here one can see a biopsy specimen of the carcinoid tumor. One can appreciate these rosettes made up of circular cell arrangement that are characteristic of a carcinoid tumor. A 54-year-old woman comes to the physician reporting chronic diarrhea for the last 6 months. She also experiences occasional shortness of breath and wheezing. Sometimes her skin flushes on the abdomen. Echocardiography reveals a narrow pulmonic valve and regurgitant tricuspid valve. What is the best next step in the diagnosis of this patient? This patient presents with chronic diarrhea, episodic shortness of breath, wheezing, and flushing. Additionally, echocardiography reveals a narrow pulmonic valve and regurgitant tricuspid valve. These findings are consistent with the diagnosis of carcinoid tumor. The next best step in the diagnosis of a patient with suspected carcinoid syndrome is to measure urinary 5-HIAA, which is a metabolite of serotonin. Let's talk about the management of carcinoid syndrome. Early stage disease can be managed by surgical resection. If the tumor cannot be removed surgically, then pharmacological therapy is initiated. Octreotide, which is a somatostatin analog, is used to decrease serotonin production. Telotrestat, which is a tryptophan hydroxylase inhibitor, is a novel drug approved for carcinoid syndrome. It decreases production of 5-hydroxytryptophan and serotonin. Telotrestat is used for refractory diarrhea due to carcinoid syndrome. Let's revisit this illustration to explain how telotrestat works. Tryptophan hydroxylase catalyzes the conversion of tryptophan to 5-hydroxytryptophan. Telotrestat blocks tryptophan hydroxylase, decreasing production of 5-hydroxytryptophan and serotonin. Let's finish this lecture by discussing irritable bowel syndrome. Irritable bowel syndrome, also known as IBS, is a gastrointestinal motility disorder with variable presentation. It is common in middle-aged women. Although the exact cause of irritable bowel syndrome is unknown, it is presumed to be caused by increased migratory motor complexes. Irritable bowel syndrome is diagnosed with Rome 4 criteria. The Rome 4 criteria includes recurrent abdominal pain at least once per week for at least 3 months. Abdominal pain should be accompanied by at least 2 of the following findings. First, pain is related to defecation and is usually relieved by defecation. Secondly, there is a change in frequency of bowel movements. And thirdly, there is a change in stool consistency. Irritable bowel syndrome is called diarrhea predominant if most episodes of abdominal pain are accompanied by diarrhea. On the other hand, it can be constipation predominant if most episodes of abdominal pain are accompanied by constipation. Finally, the mixed type of irritable bowel syndrome is characterized by painful episodes that are equally accompanied by diarrhea and constipation. Irritable bowel syndrome is a diagnosis of exclusion. It is characterized by no structural abnormalities on intestinal biopsy and no elevation of inflammatory markers such as CRP or ESR. There are also no specific antibodies, and a complete blood count is also normal. The initial management of irritable bowel syndrome focuses on lifestyle modifications like a low FODMAP diet. FODMAP stands for fermentable oligosaccharides, disaccharides, monosaccharides, and polyols. These are gas-producing substances which should be avoided by a patient with irritable bowel syndrome. Diarrhea-predominant IBS can be treated with antidiarrheal agents such as loperamide or diphenoxylate. On the other hand, constipation-predominant IBS is treated with bulk-forming or osmotic laxatives. Another treatment option for constipation-predominant IBS is lubiprostone, a prostaglandin analog that opens chloride channels in the intestinal mucosa, promoting fluid and electrolyte secretion. Abdominal spasms associated with irritable bowel syndrome are treated with antispasmodics like dicyclamine or hyoscyamine. Here's a table summarizing the information that we discussed in the lecture. Pause the video and take a moment to consider this table. A 31-year-old woman comes to the physician reporting recurrent abdominal pain and spasms for the last 6 months. She experiences pain 3 to 4 days per week. Pain is relieved by bowel movement. She also has more frequent bowel movements than before. Her vital signs and the physical exam are unremarkable. Laboratory findings include complete blood count. C-reactive protein and ESR are normal. Esophagogastroduodenoscopy with biopsy shows no abnormal findings. Which of the following medications can be used to relieve abdominal spasms in this patient? A. Diphenoxylate. B. Methylcellulose. C. Lubiprostone. D. Dicyclamine. This middle-aged woman presents with recurrent abdominal pain and spasms for 6 months. She experiences pain 3 to 4 days per week. Pain is relieved by bowel movement. She also has more frequent bowel movements than before. These findings suggest the diagnosis of irritable bowel syndrome. Irritable bowel syndrome is further supported by normal complete blood count, C-reactive protein, and ESR. Additionally, esophagogastroduodenoscopy with biopsy shows no abnormal findings. 2 medications that can be used to relieve abdominal spasms in irritable bowel syndrome are dicyclamine and hyoscyamine. Therefore, the correct answer is option D. Here is a slide reminding us of the management of irritable bowel syndrome. Let's discuss why other options are incorrect. Option A, diphenoxylate, is an opioid medication which is used to decrease the frequency of bowel movements in diarrhea-predominant irritable bowel syndrome. It does not work as an antispasmodic medication. Option B, methylcellulose, is a bulk-forming laxative which is used to increase the frequency of bowel movements in constipation-predominant irritable bowel syndrome. Finally, option C, lubiprostone, is a chloride channel opener also used in constipation-predominant irritable bowel syndrome. And that concludes our lecture on carcinoid syndrome and the irritable bowel syndrome.